This video I am discussing about the bleeding history. So bleeding history, we know that ITP, idiopathic thrombocytopenic purpura, hemophilia, these are bleeding history can be present, or non-accidental injury also come. So if someone telling that mother telling the chief complaints is bleeding anywhere in bleeding, first onset, course and durations plus hookup. So what is hookup? H for hemodynamically stable or not. Hemodynamically stable, like fainting, awareness of the heartbeat. So we ask that after bleeding he was normal, or any awareness of the heartbeat, or fainted the child. Then onset, when it first started, how long he is suffering this condition. Color of the bleeding. Color of the bleeding, very important, is that fresh bleeding or not old any bleeding. Then patient pee poo, is that the bleeding associated in the pee poo. We know that henoscoline purpura sometimes complicated with intersusceptions, there is poo, recurrent jelly present. Then A for amount of the bleeding, is that how the amount of the bleeding, a cup, spoon, like that we ask. Bleeding from other side, is there any other site of bleeding, all site of bleeding. So first bleeding, I'm again analysis the chief complaints, onset, course and durations, what make it better and what make it worse. Then HOCAP. So H for hemodynamically stable or not. How can we understand, like the child is become fainted after the bleeding episode, is there any awareness of the heartbeat, the tachycardia is present or not, child is in shock or not, we need to understand. Then the onset, how long is this bleeding occur. Then the color of the bleeding, is that fresh bleeding or any old bleeding. Then the patient pee poo, is there any present or not. Now amount of the bleeding and bleeding from other sides. Epistaxis, if the child has chief complaints, so one side of the nose or both sides, how was it stopped, we ask. Hematemesis, then food particles present or not on the bleeding. Pallor, again chief complaints is pallor. The child is pale, mother is telling my child is pale. So onset, course and durations, what make it better and what make it worse. And hookup. Hookup, we know that H for hemodynamically stable or not, that is we know by fainted child or awareness of any heartbeat. O for the onset, C for the color of the bleeding, and the patient pee poo present or not, the blood, the amount of bleeding, A for, and B for the bleeding from other sides. So this is a Pallor chief complaints we analysis. Thank you.